Hey guys, how are you? It's Courtenay Hall, Editor-In-Chief of Bella Magazine, and I'm super excited to be here with one of my favorite doctors, Dr. Marc Elkowitz. How are you, Dr. Elkowitz?
I'm great. How are you?
Very good. Well, a lot of my friends and family know I'm a huge advocate of looking your best. And Dr. Elkowitz is a plastic surgeon, and he's answered so many of my questions over the past year about how to look younger, because I'm getting up there a little bit. So, you know, my biggest question, Dr. Elkowitz, is always how to make my face look younger. So I know you do facial rejuvenation. So can you tell me a little bit about that?
So there's basically two pieces to facial rejuvenation.
Okay.
We want to turn back the clock. We want to look younger.
Yes.
Some people are born with certain attributes that actually look like they've aged a little bit. There are some 20-year-old women with flattened eyebrows, and those look older or grumpy or tired or whatever.
That's right.
But for the most part, we want to get at turning back the clock. You know, women start hitting 40, 50, 60, and they want to look more like 30, 40.
Exactly.
So there are certain things that generally go with everyone as they age. Some women will have their upper eyelids worse than their neck. Some women will have their neck is a problem and their upper eyelids are great. So everyone ages differently, but the primary things that we look at with aging is, number one and first and foremost, is skin.
Okay.
Skin care starting at a young age goes a long way. With that said, some people, and I say women, but men as well, their skin ages differently. They have more wrinkles, less wrinkles, sun-damaged skin. And that's the first thing, because that's the wrapper for the whole show.
Right.
And then you get into other things like position of eyebrows, upper eyelids, extra skin, fat, lower eyelids, extra fat, skin. Those things give the tired look or the grumpy look. There are certain aspects with mid-face, but what most people are concerned with is the lower face and the neck, the jowling, the hanging skin on the cheeks, the hanging skin on the neck. Those two bands, we call those platysmal bands. Both men and women hate those.
I mean, I personally hate it. And
well, you don't have them.
well, it's starting though. You know, I'm going to be in your office.
We'll have to
sooner
keep
than
an eye
later.
on you.
Let's keep an eye on it. But you know what it is? Okay, that bothers me the most lately are the eyes and the neck. So how do you fix that in a easy way without being down for weeks? Like,
Right.
What's a quick plastic surgery fix to fix those eyes and the neck? I need to know.
Yeah, well, the skin, like we said before, skin care, skin rejuvenation. So there's basically three steps or three levels of intervention, for lack of a better word, that we can do. We can do skin care. That's good aesthetics. We have estheticians that take care of the skin health, facials, cleansing, that type of things. That type of thing. Then you get into a little bit more aggressive, the peels, the chemical peels, the low-level resurfacing of skin. That helps with general appearance of skin health. It helps with small wrinkles, things like that. Then with skincare, we get into a little bit more invasive, which would be, for example, lasers, or more aggressive peels that, let's say, the plastic surgeon would do. So that's kind of low.
Absolutely.
The medium is what you hear a lot about, is the injectables.
Yeah.
Why? They allow you to do certain things and make certain moves that general aesthetics and skincare wouldn't do, yet everyone's very happy about the fact that they're not surgical.
That's right.
So the good thing about the injectables is that in the right hands, obviously, they're very safe, tried and true. There are millions of injections of these things, and the patients are very happy with it. You just go to the shelf, you can grab what the patient needs, and in minutes, it's over. In general, those are the fillers, which help fill deeper lines, deeper wrinkles. We can get a little more aggressive with them and try and change facial contour a little bit.
Okay.
And then you have what we categorize as the muscle paralytics. Botox is the one you hear of. There are others. There's Xeomin, Dysport. There's others. And what those do is they stop the muscles in your face from moving.
Yeah.
So if you get certain wrinkles, these, what people call the 11s,
You can't see mine.
we try
I got
not
it.
to use the word 11s in the medical chart, but yeah, you know, the 11s or things like that. Heavy wrinkles in the forehead, crow's feet, those areas. Well, those are the body doing what it's supposed to be doing. The way that we look alive, we smile, we call that facial animation. Facial animation is the stuff on the outside moves because of the stuff on the inside. So in the face in particular, the skin is connected very closely to the muscles underneath. So the body has evolved to learn how to move those muscles to move the skin. Sometimes those moves are undesirable, so we have medicine to make those moves go away. So what we do is we'll inject in certain areas, and that muscle can no longer contract. So it's just a math equation that now the skin overlying it can't contract and wrinkle.
Absolutely.
And we can get even a little more creative, because when we're making some of those muscles not move or limp chemically, temporarily, what happens is certain structures will move one way or the other towards or against certain areas. So for example, if we inject one particular area over here, well, that muscle will soften and it may allow the brow to come up a little bit.
Absolutely.
So we can play games that way.
You know what, Dr. Elkowitz, I want to thank you so much, because I feel like this was so informative. I think that women really, you know, starting now in their 20s all the way up to, you know, our parents, you know, my parents' age, in their, you know, 70s now, you know, everyone wants to look and feel better. And I think that if you can do it, I think that be empowered to do it, you know? And Dr. Elkowitz is the perfect person. He's in New York. He can answer any of your questions. He has an amazing website, an amazing staff, and he's an amazing surgeon, and we only put the best of the best on the Bella Medical Advisory
Now
Board.
you sound like my wife again.
Yes, well, I love your wife, so it's one big happy family over here. And know everyone that Dr. Elkowitz is who I will be going to, and maybe I'll even bring you along for that fun ride. I'm not ashamed to have a little neck or eye lift.
We're gonna look
talk
into
about
that. We're gonna
Yeah,
talk.
I'm
Not on
excited.
camera though.
Not a care, but I'll show you the before and afters.
There you go.
So thank you so much, Dr. Elkowitz. It was
Thank
such
you.
a pleasure. And we'll talk again soon. So if you guys have any plastic surgery questions, you can always visit Dr. Elkowitz on his website. You can pick up a copy of Bella. He submits amazing content every issue. And he can answer all of your plastic surgery
This
needs.
coming issue, we have facial rejuvenation.
Yes, we
coming up.
do. Facial rejuvenation in our March-April influencer issue.
Can I give the website?
Of course.
You give
please
yours
do.
and then I'll give mine.
Okay. BellaNYMag.com.
And plasticsurgeryofnewyork.com, spelled out.
That's right. Thanks, guys. Have a good one.